Neuroblastoma is a type of cancer that develops in immature nerve cells, typically in children, and often originates in the adrenal glands, but can also occur in other areas of the abdomen, chest, neck, or pelvis. The investigations and treatment for neuroblastoma are tailored to the stage and risk category of the disease. Here's an overview. Investigations for neuroblastoma. 1. Clinical evaluation. History and physical exam. Assess symptoms such as a lump in the abdomen or neck, weight loss, fatigue, or bone pain. Neurological assessment to check for nerve involvement or spinal cord compression. 2. Imaging studies, ultrasound, initial imaging for abdominal masses. MRI CT scan, detailed imaging of the primary tumor and any metastatic spread. MIBG scan, methiobenzoguanidine, a nuclear medicine scan that detects neuroblastoma cells. X-rays to identify bone involvement. 3. Laboratory tests, urine tests, elevated levels of catecholamine metabolites, e.g. phenylmandelic acid, VMA, and homovanillic acid, HVA. Blood tests, complete blood count, CBC, liver and kidney function tests, and levels of lactate dehydrogenase, LDH. 4. Biopsy and pathology, tumor biopsy, histological confirmation of neuroblastoma. Bone marrow biopsy and aspiration to check for marrow involvement. 5. Genetic and molecular studies, MYCN amplification associated with aggressive forms of the disease. Chromosomal abnormalities, such as 1p and 11q deletions. ALK mutations, potential therapeutic target in some cases. 6. Staging studies. International Neuroblastoma Risk Group Staging System, IRGSS, assesses extent and risk based on imaging-defined risk factors. Bone scans, PET scans, alternative imaging for metastasis. Treatment for neuroblastoma. Treatment depends on the risk stratification, low, intermediate, or high risk. 1. Low-risk neuroblastoma. Observation. Some small, asymptomatic tumors regress spontaneously. Surgery. Complete resection of the tumor is often curative. 2. Intermediate risk neuroblastoma. Chemotherapy to shrink the tumor before surgery, e.g. vincristine, cyclophosphamide, doxorubicin. Surgery to remove the tumor after chemotherapy. 3. High-risk neuroblastoma, induction chemotherapy, intensive chemotherapy to reduce tumor size. Surgical resection, removal of the primary tumor after chemotherapy. Radiation therapy, targets residual tumor or metastatic sites. Stem cell transplantation, high-dose chemotherapy followed by autologous stem cell rescue. Immunotherapy, anti-GD2 monoclonal antibodies, e.g. dinutuximab, combined with cytokines and isotretinoin to target residual cancer cells. 4. Relapsed refractory neuroblastoma, targeted therapy, ALK inhibitors, e.g. crizotinib for LK-mutated neuroblastoma. Experimental treatments, clinical trials involving CAR T-cell therapy, new monoclonal antibodies, or novel chemotherapeutic agents. Radiopharmaceutical therapy, MIBG therapy. Supportive care, pain management, analgesics for symptom control, nutritional support, maintaining growth and energy levels. Psychosocial support, counseling for patients and families. Monitoring, regular follow-ups to detect recurrence or late effects of treatment. Prompt diagnosis and appropriate staging are essential for determining the most effective treatment plan for neuroblastoma.